welcome to the Bamboo Parenting Podcast. My name is Kayla, I'm a psychology researcher,
And I'm Leah, a practicing psychologist.
and we are joining you on beautiful Bindal and Woogarugaba country in Australia. We interview experts on self-care, infant care, and relationships. In this episode, we sit down with Georgina, also known as Mama G, a midwife and lactation consultant based in Townsville. Georgina discusses the difference between a midwife and a doula, maternity models of care, labour progression and childbirth options, as well as the postpartum recovery process.
Join us as we explore preparing for home births and navigating maternity care with insights that inform and inspire. We hope you enjoy.
Welcome, Georgina. We're really excited to have you here today on beautiful Bindal and Woogarugaba country. How are you doing?
Great, thank you.
All right, so we'd love to hear a bit more about your career as midwife and a lactation consultant, if you'd like to start there.
Yeah, I'd love to. So I grew up in Brisbane. I really wanted to study. So I finished my general nurses training at Princess Alexandra Hospital in Brisbane. And I was very, very fortunate to slip almost immediately into doing my midwifery training, which again was still hospital-based training. And I just loved being a midwife. I really felt like I earned my certificate, as it was called back then. Worked really hard, was fascinated by labour and birth. So then did my child health training, went overseas for a bit, came back, moved to the north to Ingham where I now live, met my husband. Very quickly had 5 children. When my boys were about 3, I really felt there wasn't going to be much in my life available apart from doing the very important job of raising my children. So about 97, I deregistered. Yeah, within a year, the local director of nursing at the health service near me phoned and said, "We are desperate for midwives. Would you please come back?" So she supported me to do supervised practice. So I worked in that model of care. I was a full-time midwifery group practice midwife till August 21, when I resigned or left behind my full-time midwifery group practice job and moved into private midwifery practice. So I've been a lactation consultant since 2015 and started supporting women to birth at home in this area. My first home birth was actually in May 2021.
That's lovely. And for mums who are looking to find a private midwife, what would you recommend? What are the steps?
You pee on a stick, or you do some preconception planning.
Yes.
You can go to Home Birth Australia, I think, has a website. They all have social media pages. Home Birth Queensland, I think it's Home Birth Queensland actually has a space on their page that's called The Big List, and basically you can search for whatever sort of birth worker you think you might like the support of in your journey.
And for our listeners at home, what is the difference between getting midwifery care when you have found out that you're pregnant and you decide to go down the midwife path, or having a doula, or are they the same?
Doulas and midwives have overlapping but very distinct skill sets. So a doula works with the family, works with the woman and her important support people to help meet the physical, emotional, psychosocial, perhaps spiritual needs of a woman at whatever stage of her pregnancy, labour and postpartum journey the woman deems is appropriate. A doula is an unregulated birth worker, so they don't have to answer to a regulatory authority, so they have great freedoms, but they also have limitations. So they're not midwives, they're not medically trained, so their skill set is limited to that supportive role, which is still incredibly important. So comfort measures in labour, helping the partner to know how to support the woman, that sort of thing, incredibly important. Whereas a midwife, the term midwife is a protected title in this country, so anybody can call themselves a doula, but you cannot call yourself a midwife unless you've completed a recognised course of study, found to be competent and registered with the health authority, which is the Australian Health Practitioner Regulatory Authority. Midwives do all those things that the doula, I described that the doula would do, but also has midwifery skill sets to manage labour and birth, using their own skill set, and recognising when things are deviating from the path of normal, and recognising who is the best person to support that woman or that baby or that family, should their care needs extend beyond the skill set of a midwife. So we recognise and protect normal and then recognise when someone else is needed. We also have great skills in emergency management, so maternal obstetric emergencies, neonatal emergencies, that sort of thing. We're required to be have evidence of recency of practice and skill sets.
That was an excellent overview.
Thank
Thank
you.
you.
I love working with doulas. They bring great depth to particularly labour and birth at home.
And how empowering to have then potentially two additional women in the room helping you birth this child.
Oh, yeah.
That support must be, and the emotional support that you both give during that period. I was wondering, like, let's say that I've just become a new, found out I'm pregnant. Like, where do we start? Like, what should I be thinking of? I know that labour is 9 months away. How do I prepare myself for that day?
I would encourage every woman who's thinking of having a baby or is pregnant to think about, what are my basic beliefs about the world? What are my basic beliefs about who I am as a woman? Imagine, I know that doulas, when they work with women, they'll say, imagine your birth in your mind's eye. What does that look like? Because if a woman can describe that, then we may get clues as to the best birth setting for that woman, the best caregivers. Understanding that we don't know what we don't know. So lots of women don't know what all their options are for pregnancy, labour and birth care and postpartum care. But I think it's good to come back to, what are your core beliefs about yourself? What's your worldview? Partners are important. Have a conversation with your partner, if you have a partner, about what their thoughts and feelings might be. And then beyond that, read and think and ask far and wide about all of the options in the area where you think you're going to birth your baby.
Yeah, would you mind giving us a little bit of an overview of some of those options? So I know when I was born, my mum had a water birth, and she was only the second woman in the Millington Hospital in Cape Town to ever have a water birth. And she actually had a little article in a local women's magazine. So it wasn't done very frequently back then, and she hadn't actually planned on it. They offered that she could, for pain management, she could lie in the bath. And then they said, all right, do you want to get out? And she said, no way, I'm staying in here. And she speaks very fondly of it. It was an incredible experience.
Oh, wow.
And I think a lot of women don't really know all of the options that are available to them. So perhaps you could give us
I would love
a
to.
little bit.
Please tell your mum how proud I am of her.
Oh, I will. She'll love to hear that.
Yeah, but her ability to advocate for herself in the thickness.
Yeah,
of
she
birth,
was
saying,
not getting out of that bath.
She may have not said thank you, but no, she might have used stronger language.
I think
but
so.
She refused to exit the pool.
That's right.
And she got the birth that she needed and deserved.
Yeah.
We're coming back to investigating your options for care, correct?
Yes.
So I'll just say at the outset that free birth in this country and globally is on the rise, because as the medicalisation of pregnancy, labour and birth in the postpartum is escalating, and the outcomes for women as a result are decreasing and intervention rates are increasing. The caesarean section rate in this country is now 38%. The World Health Organisation says that maybe 10 to 15% of women and babies could benefit from a caesarean section, either for the benefit of the woman or her child, and anything above that rate, there is no demonstrated benefit for mothers or babies. So we're actually causing harm, and those harms may be immediate, medium term, or even long term. So free birthing means you're choosing to birth probably in your own home with the support of your partner, a friend, but no medical skilled attendants. You may choose to have a doula in your care, but as I said earlier, a doula is not a regulated caregiver. Beyond a free birth or a birth attended at home without a skilled birth attendant, but in the company of a doula, I guess the next step beyond that in terms of likelihood of intervention and better outcomes would be to employ a privately practicing midwife such as myself. So you directly employ a privately practicing midwife. You pay that midwife to care for you through your entire pregnancy, labour, birth and postpartum journey. In some states, not Queensland, you can have access to a publicly funded home birth service. It is what we call a postcode lottery. So just because it's available in other states and territories in Australia other than Queensland doesn't mean those options are evenly distributed throughout those other states and territories. They're very tiny little privileged pockets. You can have continuity of midwifery care, part of a public health service. So in this town, you have the option of going to the birth centre and having continuity of midwifery care with your own midwife in that setting until you develop risks or care needs that mean you can't continue within that model of care. There's also in this town the option of an all-risk midwifery group practice where you still get your known midwife to journey with you all the way through your pregnancy, labour, birth and postpartum. But regardless of the unique characteristics of you as an individual woman, or how your pregnancy journey may change as your pregnancy progresses. You won't lose your midwife, you won't lose your model of care, you won't lose your place of birth, which may happen if you're stepping into that previous model of care that I described. And then you'll have the support. You always have the support of those extra healthcare professionals if you need them, like an obstetrician, an endocrinologist, neonatologist, physios, whatever your need is. So that's kind of and you also got the option in this town, which is what we call standard care. So because the birth centre care and the all risk midwifery group practice have got limited midwives with limited places, those positions are taken up very, very quickly. So not all women who would like access to those models of care get in. So then you default back to what we call standard care, where you go to women's and children's clinics. You probably see a different midwife every time. You probably see a different doctor every time. So there's not that beautiful continuity of care that other women get to enjoy. So that's what public midwifery care looks like. You can employ a private obstetrician to care for you. So you would most likely drift in that direction if you already had health insurance to cover the cost of that. So getting a referral from your GP to see a private obstetrician, visiting with that private obstetrician, and you do get continuity of care in terms of seeing the same obstetrician at every visit, but there are no demonstrated clinical outcomes for that model of care compared to continuity of midwifery care. When you choose to have your baby with that type of care, then you choose to birth in a private facility where you'll go in at some point, either in labour or not in labour because you're having a planned induction or some other circumstance, planned caesarean, and you're cared for by the midwives that are employed by that private health facility. So I think I've described the gamut there.
Yeah.
So there are a lot more options than people probably realise.
And isn't it lovely that you started at the beginning of our conversation that it's all about you as a woman, your core beliefs and what you want. And really, when you're making those decisions, it probably always reverts back to what do you already know? What would you like to have happen? What options are available in your area? Because, we can go rural and remote and your options are that you have to come to a major city to have a baby. But, getting those people on board with you.
And that's sometimes not easy to do. As women, we're acculturated to be good girls and don't rock the boat, don't be difficult.
Yeah, someone in authority, especially in a medical setting, says something and you go with it.
Yep. In my practice, two things always trump my clinical decision-making and my own opinion as a midwife. I absolutely respect the woman's right to bodily autonomy, in capitals, in bold. The woman always has the right to consent or decline care. The other thing that's really, really important is intuition, and who on the planet is most invested in the well-being of their baby, but the woman who is carrying that child.
That's sort of the key, right, is you have that relationship, so she's much more likely to advocate and share her intuitions with you than she might be with a stranger in a hospital setting. And I will often say, women, practice saying no to me. I just love it when women say no. Practice being assertive, because you're bringing a child into the world. You're going to have to be an advocate for your child. Can you practice being assertive with me? Just practice saying no. Promise you won't see a cranky face. And then when you're feeling a little braver about doing that, then you can practice it on other people. That's incredible.
I love it too.
I was wondering, what advice would you have for women who are scared of giving birth? So, for instance, I have gone down the rabbit hole of looking at episiotomies, and I read on the Australian Institute of Health and Wellbeing that around 1 in 4 new mums has an episiotomy, and then there's obviously the range of lacerations. So, is there something we should be considering but not be overly fearful of? How do we sort of navigate that as someone who has never given birth yet?
Yeah, fear of childbirth is a big thing. And I think being able to verbalise it is really important. When you're working with your own continuity of care midwife, those things will float to the surface. You'll feel that you're in a safe space where you can say those things out loud. If I were to talk about episiotomy particularly, there was an era where episiotomies were routine. In more recent times, episiotomies are cut because there might be concern about the baby's well-being, and we want the baby born quickly. So the baby's close to being born, but want the baby born quickly. If there's some clinicians might justify cutting episiotomy if they're very concerned about the woman's perineum and they think it's going to tear very badly. That may or may not be an appropriate choice. And some episiotomies, probably the biggest reason episiotomies are cut these days is if there's going to be an assisted vaginal birth, so a vacuum extraction or a forceps birth. Spontaneous labour at home, at term, freedom of movement, immersion in water or in the shower. If you're not in the shower and you're not in water, then having a midwife protecting your perineum with warm, moist compresses, which is an evidence-based way of protecting that part of your body against severe tearing. So yeah, fear of childbirth, it's a thing. Spoken or unspoken, you're more likely to address that if you have a trusted caregiver. There's plenty of literature out there about it if you want to find it. So I think recognising that fear and naming it and talking about the specifics and then having someone skilled in having the conversation would be wise.
That's so lovely. Someone you can actually, be open and honest about and have a good chat and say, this is what I'm feeling.
Yeah.
How can you support me, I should say.
The move away from caregivers, midwives not wanting to do episiotomies is because now we understand that the clitoral body actually extends all the way from the top of your anatomy down the sides of your labour and beyond.
Yeah.
And if you cut an episiotomy, you're actually cutting through the clitoral body. So it may well affect your future sexual function. Cutting episiotomy makes you more likely to bleed more heavily after your birth. There are lots of reasons not to do an episiotomy.
Yeah. Very interesting.
It is
I was
interesting.
also, about sort of traumatic births, friends, obviously anecdotally, but friends and family that I've spoken to who have had challenging birth experiences, it was very little to do with unexpected medical things that occurred and all about how the people in that situation responded. So how the medical staff treated them in that situation when something, unexpected happened. So yeah, if you set yourself up to have people around you that you feel that you trust and feel well supported by, even when things don't go to plan, even if you do have a tear or something, that's really how you get through that the best possible way you can.
Yeah, that's what the evidence tells us. 1 in 3 women in this country will say that they have birth trauma. That's a lot. 30% of women will verbalise that they had birth trauma, and a portion of those will actually have PTSD as a result of their birth. And many of those women will not go on to have another baby. Or if they do, they'll choose an elective caesarean section so as to have control over the circumstances, the timing of their birth.
I was wondering for women listening, and they may be pregnant and they kind of think to themselves, how do I know when I'm in early labour? What are the first kind of stages and steps and what will they be feeling?
Yeah, so I speak with women about what it's like to be for the last 3,566 days of your third trimester, because it feels that long. Towards the end of the pregnancy, you might notice some changes. You might have increased vaginal mucus loss. You might have this thing that we call a show, where your mucus plug comes away. Okay, you might get a little bit of lower abdominal discomfort, a bit like period pain, a bit achy, a bit of lower back pain, some thigh pain. Some women experience that they just find themselves going to the toilet to empty their bowels a lot. Lots of loose bowel motions. Within your pelvis is very limited real estate. So you've got a baby's head, we would hope, a baby's head, a bowel and a bladder, and the baby deserves to compete and win the race for occupation of that pelvis. So you'll be going to the toilet and doing lots of little bits of wheeze. It is a fallacy that your baby will become quiet in terms of movements in the days leading up to labour and birth. I hope that message is loud and clear to women these days. If you feel like your baby is moving less than usual or not moving at all, you must call your maternity care provider. Even if it's 2:15 on Sunday morning, you make the call and you will be gladly received and cared for, because we want to reassure everybody that your baby is well, and if your baby is not, then we can do something about it. So you don't wait for the sun to come up. The quality of the baby's movements change. They go from being big, distinct kicks and bumps and elbows and knees and rib jabs to kind of there's not much room. So you get kind of tight, wriggling movements, less defined, but they're still there as frequently as they were before. The character and the quality of the movements change. So yeah, you might notice all of those things. Some women get incredibly overpowering urge to nest. So you'll be emptying out your kitchen cupboards and getting the dust from the far back corner. on your knees, which is great. You know, being very physically active in all sorts of positions is great for your pelvis.
Never thought of it that way.
Yeah, absolutely.
I'm going to add in there that I do remember nesting and getting quite upset with my husband because he wouldn't pull the TV away from the wall, and I physically couldn't get him behind there to get all the cobwebs and that away. He thought I was a lunatic.
Well, you weren't. You were responding to the hormonal physiology that was your body. Yeah. So, yeah, all of those things. I don't believe there's no such thing as false labour in my mind. It's all preparation. When you're pregnant, most of your pregnancy, your cervix actually points at your backbone. And as you move closer and closer to the day that your baby chooses to be born, your cervix will reorientate from pointing at your backbone and rotating forward to be pointing in alignment with your vagina. And you might notice some changes where that cervical plug comes away. That means your cervix has been moving a little bit and has released that plug of mucus. At the same time, your cervix might be getting softer. It might also be shortening in length and maybe beginning to dilate a little bit. So in pregnancy, your cervix feels like the tip of your nose, quite firm and springy and boingy. And then as you're getting closer and closer to labour, it initiating ends up feeling like the side of your face, nice and soft and squishy. So there are some of the changes that you might notice. Yeah. And as you start to labour, you might notice a generalised tightening of the whole abdomen, and it won't really take much of your attention. You just might go, oh, yeah, that's like those Braxton Hicks I've been having for the last 4 to 6 weeks or longer. But then you get that achy period pain feeling, or the backache and the leg ache. And then after a while, you're going, oh, I think I've had a few of those today. And you might look at your watch and say, oh, actually, I'm having a few of these. And you might start timing them. And then over time, these sensations will start coming more frequently, lasting for longer, grabbing more of your attention until you can't hold a conversation any longer through these, what I prefer to call surges rather than contractions, waves of uterine tightenings. And welcome to labour, you're having a baby.
And thinking about those movements, you said it's really good to, when you're nesting, moving around. What are the recommended movements? So, you know, sometimes a woman will sit on those exercise balls, or they tell you to walk around, or they'll say, some people say have sex. There's like a lot of conflicting information about what you should be doing. What are the best movements during that time?
Yeah. Upright, forward, open postures. Our pelvis is not rigid. It's not a rigid bony structure. There's some cartilage right in the front of our pelvis. It's called the symphysis pubis, and it's becomes quite mobile in pregnancy. And then at the back of our pelvis, between our sacrum and the other bony structures of our pelvis, there are joints there and there as well. So there's at least 3 points in our pelvis, as well as our hip, that move to accommodate the needs of our body and the needs of our baby when we're labouring. So I'll come back to intuition. There's no one-size-fits-all approach to this. If you can connect with your body and listen to what your body is telling you that you need to do, then you'll know what you need to do. You need right now to clean behind the TV. I need right now to clean the far back corner of my bottom kitchen cupboard. So tapping into your intuition, I think, is very important. I think there's a lot of emphasis on being active and moving. But if your body's telling you, or your brain is telling you, I'm really tired and I'd just love to have a deep warm bath and then snuggle up in bed and have a little nap, do that.
I love that. Just trust yourself. Your body knows what it needs.
Yeah. Oxytocin is the hero hormone of labour and birth and breastfeeding as well. So oxytocin is a shy hormone. So if you're stressed, if you're in pain, if you're embarrassed, if you feel watched, then oxytocin is not going to flow. I also talk about oxytocin as the hormone of love, labour, lust and lactation. Okay, so the oxytocic event that led you to conceive your baby is also going to be the oxytocic event that's going to help you to labour well. So perhaps sex is a good idea for you, or just lots of cuddles and kisses and feeling close and loved. Yeah.
Ways to improve that, increase that oxytocin.
Absolutely.
Love that. And what about mums who are very concerned about having the bag packed, everything ready? My mum said she cut her fringe before.
Imagine not leaving home at all. The first birth at home I attended, 3 hours after the woman birthed the baby, I left her home and I thought, holy crap, I'm leaving her house. They're in bed with their baby. I'm leaving their home.
Yeah.
If you're not organised, it doesn't matter.
They have clothes.
Your partner will probably bring the wrong undies and the wrong nightie and all the wrong things. There's plenty of shops. You can send him back home. You can ask your friend. She knows where your undies are. Blah blah blah. Yeah, it doesn't really matter, but it does help to be organised. So I would suggest pack a bag for you, pack a bag for baby, make a list, making sure that the car seat for the baby is fitted from 36, 37 weeks is probably wise. When I share, I said my suggested list for home birth supplies, the first sentence is have your baby car seat fitted from 36, 37 weeks, because just because you're planning to birth at home doesn't mean it's going to happen at home. And just because you do birth at home doesn't mean we might not need to go into hospital after the baby's born. And not every transfer to hospital, in fact, most don't involve an ambulance. We usually will go in the family car. So having the car seat fitted would be a good idea.
Yeah, great. Talking about positioning, I was wondering about positioning when you're actually in labour.
Yeah, well, if you're labouring and birthing in your own home, it's your territory, it's your space, you own that space. So you're going to move intuitively throughout your house. So you're going to spend time in the toilet, in the shower, in the bath, in the kitchen, in your bedroom. You might walk up and down the street. That's a great place for just adopting the positions and the movement that you feel you need to do intuitively. And you're not going to be permission seeking to do that. Imagine then going to hospital and going into a birth suite, and your ownership of that space is not quite so automatic. So if you do choose to birth in hospital, I suggest you take your own pillow, you take a throw, a little quilt, lightweight quilt, so you can throw it over the bed that says, that bed's mine, it's not yours. You can always take the brakes off the bed and turn it on its side and put it in the corner of the room and put a mat on the floor, because the worst place you can birth is on your back and in bed. Okay, take your oils, take your diffuser, take some fairy lights, put some affirmations up, take your playlist,
music,
play your music,
as early as possible.
all of that. Take your support people that are all up to speed on what your hopes, wishes, and dreams are, and that you've documented them, and they can speak with and for you if you're not able to speak because you're doing the hard work of labour. So moving around is absolutely ideal, and midwives are in the business, no matter which midwife where, they're in the business of facilitating upright, forward, open postures. And if you can't do that because you've had an epidural, your midwife does have the skill set to help you to be positioned in bed in such a way that that can be replicated as best it can. Yeah.
Great.
Yeah, I know from my own experience that it's also that being intuitive and knowing what your body wants to. It kind of just does what it needs to do. It's quite surprising.
You're just led. You find yourself doing things you didn't cognitively work through. I can remember labouring with my first, and I came to a realisation that for some time I had been crawling on my hands and knees on the floor. Clearly, my body needed to be in that position in order for my baby to be positioned the way that she needed to be for the great birth that I ended up having. And I've seen women adopt the most unusual positions, and it's because their body told them that they need to do that.
And talking about that really active stage of labour, where you feel that everything's going to that next level, how do people know the difference between being in early labour and active labour? Other than I feel that they will feel it.
Yeah, you will know.
You'll know,
what we say. Yeah,
but nice to know beforehand, what to expect.
Preparation. So I might be in labour. This is exciting, and then the increasing intensity of your surges to the point where you can't have a conversation any longer. You have to bend over and lean on the kitchen bench, sway your hips from side to side. You might start to get a little bit more vocal. You might want to retreat from the world and even go to the bathroom or the toilet to get away from people, either in your own home or in the hospital setting. Yeah, just your labour fully occupies all of your perception, your psychology, your physical being. The important thing about understanding the hormonal physiology of labour is that it all happens in our limbic system, so our deep brain. And if our frontal cortex is constantly being engaged by bright lights, strange people, conversation, noises, smells, then we're going to be lifted out of our limbic brain into our frontal cortex. So how will you know? You'll go deep within yourself, and if your environment is safe and supported, you'll do the good work that is the hormonal physiology of labour, and your labour and birth will unfold just as it's meant to.
As you talk, I just cannot stop going back to my own labours. I've had 3 children, so when you're speaking, I'm like, oh, that is exactly what was happening. That was what was going on there. But there was something that you said about, when we go deep, And I remember not being able to talk.
Mhm.
And I think that there was something we touched on before about whoever's you're in the room with you, or whoever's your carer or your partner, is really letting them know what your wishes are. Because I know for myself, I could not talk. In my head, everyone was talking and I was kind of answering, but I physically could not talk back to them. But my husband was there as the person that was like, okay, this is what Blair would wish, or what, you know, and being really close with them to know that, that's what I'm trying to say in a long-winded way. But basically, I think it would be really important for women to know that their partner needs to also be on board so they can speak when they're doing that hard work and they really are inside themselves.
Yeah, and even put that in your birth plan.
And also them talking to you, because I remember, and I hope it's not too much for the listeners to hear, but I remember being quite in that deep, active stage, thinking, second child, so thinking I've got a long way to go. And my husband said to me, oh my gosh, I can see it, because we didn't know if it was boy or girl, but I can see it's here. And to me, I was like, I thought I was still hours away. And that was the best thing he could have said to me, because I was like, holy moly, here we go. And I knew it was close, but because of the communication he then had with me, it just set everything off. And I think she was born very quickly from there. But it's really that communication that you have with each other.
That's beautiful.
What other ways you see partners or whoever that support person is supporting the birthing mother?
I'm a huge fan of hypnobirthing. I see hypnobirthing as 75% for partners. Partners generally don't know how to help. So women who come into my care, I will encourage them to think very seriously about doing a hypnobirthing course.
Would you mind giving us a little overview of hypnobirthing, just broadly for listeners who don't know about it?
I'll try. It's coming from an understanding of what the normal physiology of pregnancy, labour and birth and early postpartum might look like, and then understanding the various strategies that might help with coping with each opportunity that comes along, depending on where you are in your labour. So various comfort measures, so massage, heat, positioning, shower, bath, kneeling positions, often different techniques to help with discomfort as your baby descends down and through your pelvis. So hip squeezes, sacral pressure, practicing those unique skills. There's different massage techniques that you can use. So some women love very firm lower back massage, very, very strong. Early in labour, you might use a technique called effleurage, which is very light, a light brushing sensation, which tricks your brain into thinking about that lovely light touch and not concentrating on the challenge that is your crescent surge. Some women really hate light touch and other women respond really well. Different other techniques, so using a long, wide sarong to do a technique called shaking the apple tree, so draping that piece of material over a woman's backside while she's on hands and knees and shaking from side to side, and that just helps relax all the muscles, including, importantly, the pelvic floor. Or another technique called abdominal sifting, where you drape that same piece of material underneath your belly. Your caregiver kind of lifts, so you take the weight of your pregnant belly off you and your poor suffering spine, and doing that same fine jiggling movement to help relax all of those important joints and ligaments and muscles, including, very importantly, the pelvic floor. So it's much deeper than that. You can listen to scripts of affirmations. You can have visual and memorised affirmations that may come to mind when you're labouring. Women will often play the music or the spoken affirmations quietly in the background, and you do that over many weeks and months through the pregnancy, so that by the time you labour, the techniques that you're using or the affirmations that you've been thinking and dwelling on for 3, 4, 5 months are such part of you that you believe them, know them, trust them. Yeah,
it's beautiful, isn't it?
Incredible.
Yeah. And it's much more than that.
Yeah, but such a nice little overview for people to know what to expect.
It's a huge, huge investment, and women often will say they've used those hypnobirthing strategies in other areas of their life.
So you've gone through the hard work of, delivering the baby. What advice would you give to women around that healing process after birth?
I would like for you to disconnect from that word deliver for the rest of your life.
Oh, women, did I say? No, you didn't have...
Women birth their babies. Okay, so women birth their babies.
That's it.
And we help a little bit. Okay, so pizzas are delivered, the mail is delivered, women birth their babies. So, yeah.
I will go forth with that.
Noted.
Thank you. Thank you. It's a sign of respect for the woman. Absolutely. And her agency and the important work that she does. So healing, there's a mantra, another one says a week on the bed, a week around the bed, a week in the house. So slow. So making your world a small place, making your bed your nest, not being up and about cooking, cleaning, meeting the needs of other people. Allow them to minister to your needs. So planning ahead, maybe making lots of meals and putting them in the freezer, talking to your trusted support people, knowing who you can call to go and get bread and milk, knowing who you can call that will come and clean the toilet for you, hang out the laundry, someone who can look after the other children, take them out for a couple of hours. Hopefully your partner is able to take some time off work. I honestly think 3 weeks is a minimum. Anything less than that is not enough. You're on a high for a week and then you're kind of settling in for a week. The third week, women often will hit the fatigue wall as well as the partner. So 3 weeks is a minimum. Helping friends and family to understand that you may actually not benefit from having them visit in the first week as much as you might like to want to see them, or they would love to visit you. Maybe just delaying the visit. Or if they do come, bring a meal and hang out the laundry while you're there and keep the visit short.
Yeah, catering to the woman's needs and not the family's needs to spend time with the infant. Or
Well, the baby doesn't need to see anybody.
That's right. Consider it as that fourth trimester that you're actually going to be spending some time healing at home. That's lovely. Thank you so much.